Welcome to the Park Nicollet Neurosurgical Department. Our culture of high-quality care is rooted in the philosophy of head and heart together. Every member of our team is strongly committed to using our heads, focusing on the science of medicine, and our hearts, practicing caring compassion. Our neurosurgical team is dedicated to ensuring every person who comes to us receives high-quality, patient-centered care. In addition to our extensive neurosurgical experience in the treatment of patients with spine, brain, and skull-based conditions, our Park Nicollet surgeons are known for their expertise in providing minimally invasive neurosurgical options. Dr. Anthony Bettini is a board-certified neurosurgeon with decades of surgical experience, specializing in the treatment of spine disorders and minimally invasive spinal surgery.
First time you meet a patient, when you walk in the door, a lot of times the patients look frightened. Sometimes because of the condition they've been diagnosed with, sometimes because they don't know what's next, and sometimes because they're actually afraid that we're going to offer them surgery. So most of that really comes down to reassurance and then taking the time with the patient to kind of go through the options and try and show people alternatives when they exist and to give them the time to understand the problem and the time to make a decision at their own pace. The nice part about Park Nicollet is that it's kind of a closed system in the sense that when a patient has a complex problem, we have a system where we can talk to colleagues in virtually every specialty. We also have a comprehensive way of looking at the patient's records, understanding their history, and that makes things a lot easier in terms of providing care, but it also makes things safer.
Dr. Praveen Bhamidi, fellowship trained in neurosurgery and neuro-oncology, specializes in brain tumors and developed Park Nicollet's skull-based tumor program.
I think every time a patient is referred to a neurosurgery clinic, they have many varieties of distinctly different problems. A diagnosis of a brain tumor changes people's perspective and their concerns, their whole life kind of changes when they've been told there's something new. I get to see and know my patients even before they're in my clinic. I have a sense of what brings them to me. I can communicate with the patient's primary care. I can communicate with the other consulting physicians who are involved. I think the whole concept of having such a closed system is amazing because we are able to deliver quality care because of that reason.
Alicia Larson, one of our physician assistants, has years of experience providing care to patients with brain and spine disorders and assisting in the operating room.
What I love about neurosurgery is the wide variety of patients that we get to take care of. I think the providers that we have at Park Nicollet are really top-notch. They care a lot about the patients. They really take the time to do a good evaluation, make sure the patient gets good care. Most of the time when I'm interacting with the patient in the clinic, first I like to get to know the patient by taking a good history, and then of course the examination, and then really taking a good look at their imaging and taking the time to go through the imaging studies with the patient to explain to them in layman's terms the anatomy, physiology, and then most of the time they're quite concerned about having surgery in general, so I take quite a bit of time to talk about the surgeon and their background and mainly just answering all their questions at the end of the interview.
Our experienced nursing staff is committed to high-quality patient care and service. Meet Kelly, Joanna, and Molly.
So when the patient comes in, first we talk with them as nurses, kind of get an idea of what's going on.
We try to do our best to just make the process as easy and go as smoothly as we can by educating patients and their families.
We're that bridge between the doctor and the patient that can help calm their nerves before surgery. I think we answer a lot of questions about what their recovery may be, what they need to do before surgery, and I think we're just that in-between person for them.
It's really important to support the families just as much as the patients because they're the ones supporting them and caring for them.
I think Park Nicollet does a really good job of focusing on the patient and their family. It's not just about treating their pain, but kind of treating the whole picture.
What I love most about Park Nicollet is the teamwork.
From the front line to the nurses to the mid-levels to the physicians, everybody plays a key part, and I think everybody works really well together here.
I am very passionate about patient education. I think that the more educated a patient and their family can be about their diagnosis and their surgery, the better outcome for them.
It's really wonderful to see the patients at their nurse visit because we've gotten to know them before the surgery, and a lot of times we do get phone calls, so we get to know patients that way.
So it's really nice to see them all the way through the process.
Our care team is eager to work with you to improve your health and get you back to what you're most passionate about. As a next step, choose the video on this site which corresponds to the topic that you are most interested in learning more about. Keep in mind that the information presented in these videos will be provided to you before leaving your appointment, and our care team will be happy to answer any other questions you may have. Thank you for choosing Park Nicollet. We look forward to meeting you.